We're a little behind, but we want to take full advantage of our all-star panel. We'll start in about 1 minute. You're Hispanic then. Make you honorary Mexican. Thank you for being so punctual. We're a few minutes late, but Larry has given us permission to go over by a little bit prior to the break, and which is a real opportunity for us to explore the demographic side of these policy issues. And let me thank again Dean Lynch for her superb presentation on the economic implications. And now we're going to move to a slightly different theme. And I'll just start it off by saying this. When my co-chairs, our co-chairs, Janet, Jean, myself, were discussing with Larry and Pamela how we should approach these issues, we kept coming back to a new reality. America is changing, and America is different than how it was when Social Security, Medicare, and Medicaid were first enacted way back when. And one of the crucial issues which we all felt, the co-chairs, Larry, Pamela, and others, was that we needed to give attention to the demographic changes, especially those changes around diversity, ethnicity, race, immigration. Suffice to say, I think what we all know or should know, but the United States will look much different in 2030 and 2050. 2030, Latinos the largest minority group. Some say we're already the largest minority group in this country. 2050, the United States becomes majority minority. So what does that mean? What does that mean in terms of these important programs? What does that mean in terms of sustaining support by taxpayers and voters of these new demographics for these programs? And just to be provocative and to put it crudely, what does this mean when it will be young immigrants and minority workers supporting older white retirees? How does this translate towards the issues that we'll be discussing at this conference? Ron Brownstein, for example, has raised the bar in terms of the provocative, crucial importance by addressing some of his articles as the brown versus the gray. Will there be tensions? Will there be opportunities for supporting these crucial programs? To address these issues, we have three notable individuals who are expert in their own right. Their bios are in your materials. We want to jump right in. One major change, Dan Crippen, who is the executive director of the National Governors Association, is ill with the flu. So we are most fortunate to have his deputy director, Barry Anderson, the deputy director of the National Governors Association, who directs the staff in representing the states on Capitol Hill and before executive administrations. And thank you very much, Barry, for filling in our regards to Dan. We also have Richard Jackson, a senior fellow and director of the Global Aging Initiative at the Center for Strategic and International Studies. As I mentioned to him, I make good use of his material because we are becoming a globalized and aging world. And thank you, Richard, for all you've done in that area. And then we have Vanessa Cardenas, who is the Director of Progress 2050 at the Center for American Progress, which seeks to build a progressive agenda that is more inclusive of the rich ethnic and racial makeup of our country. And thank you, Vanessa. Between you and I, we'll make up the Hispanic caucus of this important conference. It's good to have you with us. So with that kind of setting the stage, I'd like to first ask Richard, and then we'll follow with Vanessa, and then we'll bring in Barry. Richard, please.
Thank you. Good morning, and it's a pleasure to be here. I never know when. It's not just the world that's aging, I'm afraid. I never, if I put on my glasses, I can see my notes, and but then I won't be able to see you. So I guess I'll opt for seeing the audience. The world stands on the threshold of a stunning demographic transformation. It's called global aging, and over the next few decades, it promises to affect virtually every dimension of economic and social life. Perhaps most fatefully, it may call into question the ability of some societies to maintain a decent standard of living for the old without putting a crushing burden on the young. My task today is to examine how prepared the United States is relative to other developed economies in meeting this old age dimension of the old age dependency dimension of the global aging challenge. That is to maintain fiscal sustainability of our benefit systems while ensuring their income adequacy. Along the way, I'm going to draw on a study which I did at CSIS in 2010 called the Global Aging Preparedness Index, in which we developed a set of metrics or indicators, if you will, projected out to the year 2040 on a consistent basis for the world's major economies that try to capture both dimensions, both equally and crucially important dimensions of the challenge, fiscal sustainability and income adequacy. As in so many stories, there's some good news and bad news. The good news for the United States is that despite the imminent retirement of the baby boom, our long-term demographic outlook by developed world standards is actually very favorable. Our social insurance system is relatively low cost by developed world standards. We have flexible labor markets. We have broad and deep capital markets, not as broad and deep as a couple of years ago, perhaps, but nonetheless, we have an entrepreneurial economy. We ought to be able to manage the challenge effectively with minimal sacrifice. Yet at the same time, we labor under a number of largely self-inflicted handicaps which offset our underlying demographic and economic advantages. So much by way of preamble. Let's start with the good news. The United States is now, and this is true whether you look at the elderly share of the population, which we define in the index as 60 plus, or whether you look at median age, we are now the youngest of the major developed economies. What's more, thanks to our relatively high fertility rate, it has come down over the past few years, but I think that's cyclical. Thanks to our relatively high fertility rate, along with France, we're the only major developed economy near replacement, and substantial immigration, which, thank you, we do a damn good job of assimilating. We will be the youngest by an even wider margin, even after the last of my troublesome baby boom generation has passed on to that great Woodstock in the sky. So we We have a significant long-term demographic advantage. Along with more favorable demographics, we also have a relatively inexpensive, depending on how you look at it, you could say stingy, but I'm looking at the resource burden here, a relatively inexpensive social insurance system. Looking at pensions alone, we are at the very low end of the major developed economies in terms of pensions, total public pension spending as a share of GDP, and we will still be at the low end in 2040. Even if you include health care, which, as we all know, costs far more per capita in the United States than our developed world peers, I think at least 50% more per capita than the next runner-up. Yet even including health care, the total resource burden of public benefits to the elderly is still projected to be at the low end in 2040. Now, perhaps none of that's surprising to you, but I think the next slide will be. Despite the modest size of the welfare state in the United States, the relative income of the elderly, and in this chart we're looking at the per capita ratio of elderly to non-elderly income, is actually at the high end in the developed world. These numbers may surprise you. If you look at CPS data, if you look at household income survey data, you're going to get a different picture. This data is on a national accounts basis. Also, and importantly, it's on an after-tax basis. And the young bear a disproportionate share of the tax burden, not just payroll taxes, but also income taxes. This is the third quintile, middle of the income distribution. Now, there are a variety of reasons for the relatively high living standard of the elderly in the United States. I don't have time to go through all of them. One of them is certainly due to the fact that private pension income or funded pension income makes up in part for the modest generosity of Social Security. Funded pension savings makes up a larger share of elderly income in the United States than in any developed country except Switzerland, the Netherlands, and Canada. In addition, elderly labor force participation rates are really at the very high end compared with other developed countries. Here we're looking at age 60 to 74, 36% in the United States. The only country that's higher is Japan. So this is one perspective on where the United States stands relative to other countries. That's the good news perspective. Now let me turn to the bad news perspective. You know, I'll take away with one hand what I gave with the other, right? The first point is that the average, or indeed the median elder, in the middle of the income distribution may be relatively well off compared to the non-elderly, but that doesn't mean we don't have an adequacy problem. Because of rising income inequality and also because of poor targeting of benefits, we have a very high elderly poverty rate. This is the standard relative measure of poverty used in international comparisons. It's the share of elderly persons with an income of less than 50% of the median for all persons. So we have an adequacy problem, and we also have a sustainability problem. We are at the low end in terms of projected total burden of public benefits to the elderly as a share of the economy, but we are toward the high end in terms of projected growth in that burden. Now, obviously, the level of spending as a share of GDP is probably the most important measure of the future tax burden and the future resource burden, but the growth in that burden can also be important because not all political economies and not all cultures are equally well equipped to accept a high public benefit level and by implication a large public sector. So the growth in the United States is very steep by developed world standards. And there are a couple of reasons. One reason, undoubtedly the one that leapt to mind, is that healthcare cost growth in the United States is so rapid. This is the standard measure of what's called excess cost growth, that is, growth in age-adjusted per capita spending in excess of per capita GDP. We are at the very high end. It's not all healthcare, though. Paradoxically, demographics are also a big driver. Again, we are the youngest, and we will still be the youngest in terms of age structure among the developed countries, but we are actually, the growth rate in the elderly population over the next 20, 30 years is at the high end of the developed world. And that's because we had an unusually, along with Canada and Australia, we had an unusually large post-war baby boom, which distorts the timing of the aging. It has been slowing it, but it will be accelerating it. And so that's what creates the fiscal shock and the labor market shock, particularly as that acts as a multiplier on health care. And the CB, it's important to point out and to realize that the CBO projects that half of the growth in Medicare and Medicaid as a percent of GDP over the next 30 years is due to demographics, the other half to excess cost growth. Finally, other countries have undertaken, in some cases, dramatic reforms, particularly of their public pension systems, that reduce their growth relative to what they would be under what I call a current deal scenario. That is a scenario in which benefit levels and retirement ages remain unchanged. And if you look at the last column, which it's the percentage difference between current law and current deal, you can see that in some countries, including Germany, Italy, and Japan, we're looking, in effect, at a relative cut in benefits relative to wages of a third to 2/5. These reforms have been structured in a variety of ways. Sweden and Italy have transitioned from traditional defined benefit systems to notional defined contribution systems that are in effect indexed to demographic change and to economic growth. Japan and Germany have introduced demographic stabilizers. I'd be happy to talk about the specifics. But the bottom line is that many countries, but not the United States, are taking aggressive action to control the long-term cost of their public benefit systems, their old age benefit systems. So it's not just that we have healthcare and demographics pushing us up, it's that other countries are actually ratcheting down. And this is the final slide, and I really think it's a bit of a paradox. The level of dependence of older people on public benefits in the United States is much lower than it is in almost every other developed country. We're looking at again at the third quintile. In most continental European countries, between 3/4 and 4/5 of the income of median elders, median income elders comes in the form of a government check. benefit dependence is much lower in the United States. That ought to make it easier to reform systems, but actually it's harder. Why? Well, this brings us, I think, to the crux of the matter, and not my area of expertise, but let me venture a thought or two. And the crux of the matter is the different political economy of the United States and other developed countries. In Europe's welfare states, benefits are fiercely defended, to be sure, by labor-linked social democratic parties. There is often extremely contentious debates about revising the social contract. Sometimes people go to the barricades. But people understand that it's a social and generational, I will wrap up within 30 seconds. People understand that it's a social and generational contract that is subject to renegotiation. Whereas in the United States, we have an earned right mentality. A colleague of mine, Neil Howe, coined a phrase for this many years ago that I thought was very insightful. He said we have a libertarian welfare state. It's a welfare state because we empower government to redistribute resources in peacetime. But it's libertarian because we don't admit that these are transferred resources. We don't want to think of it as a welfare state. We want to think of it as an earned right, as a quasi-contractual relationship with government. And that makes it much harder to reform in the United States than in Europe. So paradoxically, we have Sweden, Europe's quintessentially, no spin, okay? So this is in quotes, Europe's quintessentially bloated welfare state that has flattened pension spending as a share of GDP in the future by indexing it to demographics and economic growth, and has even added a mandatory, funded add-on account to its pay-go system. And then you have the United States, where we're tied up in knots over a revision of the CPI. So let me end there. Thank you.
Thank you, Richard, and apologies. I think we could all go hear you for another hour and a half. You've given us some really fascinating data, which in part goes against the conventional wisdom, and your implications that you draw out, I think, set the stage nicely for perhaps another way of viewing our situation vis-a-vis the rest of the world. Maybe we can even learn something from other parts of the world.
Would that be novel?
That would be novel. So thank you. And now I will ask Vanessa to please join us up here.
Thank you so much for having me. This is very fascinating to me, and I also think we should learn a lot from other countries, so we should see. I think I have a few slides. Let's see, this look great. So my name is Vanessa Cardenas. I work at the Center for American Progress, and I oversee a project called Progress 2050. We call it 2050 because when we started the project, the census projected that by 2040, our nation will become minority majority. But then they changed it to 2042. And then it went back up to 2043. So we figure 2050, we know this is going to happen. And now, so that's why. And also because we did not want to call it a diversity or a minority project, because this is about all of us, whether you're black, brown, or white. This is about our collective future and what our vision for our nation is moving forward. So let me just start a little bit with some of the projections that I have in terms of demographic change here in the US as it relates to race and ethnicity. I don't have a lot of slides, but I hope the ones that I show you will interest you. These are actually, the census just released an updated projections in December of last year, and we have not had a chance to update those, but you can, the trends remain the same. And you can see that from the slide, that the Latino population is pretty much going to double. Let me see, where's the pointer? There you go. So this is where we are right now, to 2010, 2012. This is the African American population. This is the Latino population, so you here see 16, 31%. The Asian American population, 5%, 8%, and the non-Hispanic white population, 64 to 45. So you see the tremendous growth in the Latino community as well as in the Asian American community. And this demographic change is not happening just in the usual gateway cities. It's happening across our nation. This is actually some maps that our partner PolicyLink, we do a lot of work with them, came up with. And you can see sort of the distribution of different communities in 2000. So the darker the color shows the highest number of people of color. So greater than 50% people of color live in those states. This is 2010. This is 2020, this is 2030, and this is 2040, and they went up to 2040. But you could totally see, especially in the Southwest, the growth of the different communities. Another, I think, statistic that's worth bearing, that today the average age for Latinos is 27 years old, and the average age of non-Hispanic whites is 42. So there's also a big age difference. And you can actually see that this change is actually happening across our nation today. I mean, we talk about 2040, we talk about 2050, but this is happening today. Today, the majority of kids under 1 are actually kids of color. And almost in 10 cities in our nation, the majority of kids overall are kids of color. And you can also see that in the millennial generation, which is the most diverse generation. I'm not going to read all of that to you, but you can see sort of the growth in terms of people of color in the millennial generation. I think that one statistic to highlight, though, is this one. By 2020, the first presidential election where all millennials will have reached voting age, 44% will be people of color. So really, amazing and just really eye-opening trends that we're seeing. And obviously this has implications for our future workforce. So our kids today are in terms of our future, I'll skip this one and go back to this one, but obviously this also has implications for our workforce today. Today, this is where we are in terms of our workforce, 12% African American, 16% Latino, 64% non-Hispanic white. By 2050, Latinos are going to make up 24% of our workforce, 13% blacks, 8% Asian. But I think it's also to note that between 2000 and 2050, Latinos mainly are going to account for 80% of the growth in the working age population. So, Richard spoke about sort of the demographic change that's happening among baby boomers, and then we have this huge demographic change among our racial and ethnic community. So what are sort of the implications? What's the result of that? I think there are two schools of thought. You have the school of thought of Ron Brownstein that talks about sort of the brown versus the gray, and I think there's some validity of that, and I think we see that especially on the immigration front. I'm sure that you have heard in the last 2 years about all the anti-immigrant local ordinances that have been implemented in places like Arizona, Alabama, South Carolina. And I think it's important to know that actually these states, South Carolina, Alabama, Tennessee, and North Carolina, saw the greatest Hispanic growth in the last 10 years. So it's communities reacting to what's happening at the state and local level. So that's one tension that's, I think, very evident in the immigration space. Another tension is also in the views of government. And, I don't have to tell you that in this last election, very much one of the issues was, the role of government, the role that the government has in our lives. And when you look at the support of people of color, there's a very high support among people of color for the role of government. So a number of polls have shown that Latinos, Asian Americans, African Americans all support the government in like 60%, 70% rates, compared to like 23% of white seniors that actually support a larger role for the government. So there are big differences on how Americans view the government. But there's also a big difference in terms of ages. For example, 59% of 18 to 29-year-olds say that the government should do more versus only 35% of 65 and older. So there's also not only the racial difference, but it's also the age difference. And then I think another sphere where we have seen these tensions between the branding of America and the graying segment is also in the election. In the election, we saw that obviously you heard the statistics, 75% of Latinos voted for President Obama, 90% of African American voters voted for him, 73% of Asian American voters versus 36% of whites. So we also sort of see this separation in terms of where people want to see our government going and our leadership going. Another thing I wanted to note in terms of the vote, last year was a high watermark for the Latino vote, where we saw 12.5 million Latino voters come out in support of President Obama. But I want to note something, that there are still 11 million Latinos out there who are eligible to vote, but did not come out in the election. So when you think about sort of the political implications of that moving forward, it's just huge. So those are some of the tensions: the immigration space, the election space, the role of, so how people view the role of government. But I think there's also a really important story to tell about, what are the sort of commonalities, and I think that's the conversation we should be having. And I want to give you two examples that I think really show that, while we're having this conversation about all these tensions up here, there is a really good story happening, especially at the local level, in two places that you might not think of. One is actually Arizona, which, as you know, is sort of ground zero for the immigration debate and all the tensions that exist there because of the growth of the Latino community. Yet Arizona just recently passed a 3-year sales tax increase to avoid cuts in education and public safety. And yes, this is even under Governor Brewer. Which I think is really notable. And the other example I wanted to give was in California, which voters in California just last November approved Proposition 30, which pretty much increased, it was an increase in education tax, and 55% of voters approved that. Now, if you think about if there's a state in the nation that's really going through this demographic change, and it's actually already there, it's California. Yet all of the voters supported more investments in education, and because they wanted to avoid cuts in education and public safety. And I think it's notable that 55% of white voters voted for Proposition 30, and again, of course, large segments of communities of color, 22% of Latinos, 11% of Asians, and 8% of African Americans. So we have high support for policies that actually are focused on investing on the next generation of Americans. So I will end there because I am really interested in hearing your questions, and I just wanted to leave you with this. I think that, yes, we have to recognize that there are tensions, but as in every challenge, there's also opportunities. We have a growing electorate that's really supportive of benefits, that they understand how important those are to create the economic ladder for the American dream. And that's very evident by their support in just benefits overall, the role of government. And I also think the fact that these communities have very recent memory of what it is like to live in places where there's rampant inequality. They sort of understand why it is important to make investments to ensure that the American dream is available to the next generation of Americans. So I think there's something really important that we need to tap into. And we also need to capture their attention when we're having these debates about the budget and deficits and so on. The other thing is that I think that local communities is really where this learning and this engaging is happening. So we really need to figure out how those communities that have been successful at engaging all of their communities, how they're doing it, and sort of lift up those stories versus focusing on sort of the tensions piece. And finally, not to buy into the zero-sum game concepts that we have, especially in Washington. We are a wealthy nation. I think we have to remind ourselves of that. Americans believe in the common good. Americans care about their legacy moving forward. And I think that's something that we all need to tap into as we have these debates about the role of government, about public benefits, and entitlement reform. So I'll stop there and look forward to your questions.
Thank you, Vanessa, for your really intriguing presentation. I enjoyed, you pointed out an event recently, the November elections, and 2012. And curiously, somebody pointed out that for our Republican friends who were surprised at the large turnout by Latinos and Asians, they had heard that, in fact, there was a secret report that might have foretold what would happen. And when they looked into that secret report, it was entitled the 2010 Census Report. Apparently, it's a real story, by the way. And you also pointed out, I think, something Richard mentioned. The replacement rate tells us also what the future holds. And Richard, I'm kind of reading into your presentation that, in fact, we're staying young relative to other countries because of this ethnic, racial diversity population. And then just lastly, I'll toot the horn of my own city, Los Angeles, California. If you want to see where 2040 is and 2030 currently lies, it's already here. Just go to Los Angeles and Southern California. The future has arrived, and so it's good that we're a laboratory. With that, however, let's move to the crucial role of states, which have always been a bellwether and also a laboratory, and where there might be balkanization and lack of progress at the national level. And as Vanessa pointed out, even states like Arizona, even states like California can show the way. And so with that, Barry, we look forward to hearing about the National Governors Association and your thoughts about these issues around demographics.
Thank you. Let me start by saying we at NGA never use phrases like even states like Arizona or California. We just don't use that. I'm Barry Anderson. I'm the Deputy Director of the National Governors Association. Dan Crippen has more than a touch of the flu and couldn't make it. He asked me to fill in for him. I've had the wonderful opportunity to work with Dan at numerous times in my career, including at the White House, at CBO. For the last 10 years, I've been in the international world, living overseas, developing much of the data that OECD and IMF was cited here, but not all of it. There was some selected uses of it, but that's not the subject of my talk today. But I'd like to begin my talk today by talking about football. And I don't mean the silly game that's going to occur on Sunday here. Instead, I'd like to talk about football. I came to Washington in 1971, the same year that the owner of the Redskins, a very wealthy lawyer named Edward Bennett Williams, hired a coach named George Allen. And Williams had just bought the Redskins. The Redskins had been losers, consistent bottom dwellers for 25 years, and he wanted to change that. He hired Allen. He gave him complete control over the team. He gave him control not only as coach, but as general manager. He built new facilities, and he gave him an unlimited budget. Shortly after that, a couple years after that, they asked Mr. Williams, after the Redskins started winning, what he thought of Mr. Allen. He said, well, he certainly has complete control, and I did give him an unlimited budget, and he exceeded it. Well, the reason I'm mentioning that is that 50 years ago, we did the same thing in setting up Medicaid. That is, we set up a program, and we gave it an unlimited budget. Oh, yes, there have been a variety of efforts to put some kind of caps and controls on it, but basically it is now as it was when it was set up, an unlimited budget. But as you know, Medicaid is a shared responsibilities between states and the federal government. And the states, unlike the federal government, not only share in the operation, but also the costs. But unlike the federal government, the states do not have the power to borrow to the same extent that the federal government does. Nor can they print money to the same extent the federal government does. And therefore, the states are looking at, as Edward Bennett Williams did 50 years ago with the Redskins, looking at this unlimited budget and saying, particularly with respect to some of the projections that have been talked about here, and saying, goodness, what are we going to do? We just don't have the ability to keep up with the expected Medicaid costs. We at NGA are working with Arizona and California and a variety of others to concentrate on cost controls, to look at particularly the high cost areas, and to see if we can't have some efforts to get control, particularly on the highest cost patients. Dan prepared a lot of these charts, some of which provide the background to the need to take a look at the federal government, and I am going to skip over most of those. Instead, I am going to go here. Here's changes in general fund spending in recent years. What has happened in the states is that Medicaid has overtaken education. This chart in particular, I think, dramatizes that. For a very long period of times, governors were worried about, and states were worried about primarily education, and other things too. But in the last several years, it's been Medicaid. And the projections for that are even worse. I mean, worse in terms of eating up more and more of the state dollars. We at NGA are very much of a bipartisan organization. In fact, I like to say that Republicans are R's and Democrats are D's. I'm not an R or a D, I'm an SOB. And that's one of the reasons why I've gotten along so well in my career in the budget world. But even looking at such things as the Affordable Care Act and all the good things the Affordable Care Act did, it still is going to drive up costs. Even after the period of the for the new Medicaid employees, after the period of 100% coverage. Again, I'm not trying to say this is good or bad. All I'm trying to do is to say this is the area where governors care about most. It has replaced other areas, and to look at what can be done. So, looking ahead, and this is a chart done by the National Health Expenditures, something that I've used extensively, and it shows both federal, state, and total costs for Medicaid, and this is the world they are facing now. And so, given this world, we at NGA are very much working with them, and the places we're looking at most is here. I think this chart demonstrates it the most. If you take a look at per capita health costs over the population as a whole, you can see the average in 2011 was about $8,700. It was already mentioned, I think, that Medicaid actually is more efficient or has a lower cost. Medicare considerably higher. But nevertheless, if you look at the percent of the population and where the costs are, they are all, or they are almost entirely at that right end. The costs are not distributed evenly in any sense of the word. This is as true for Medicaid as it is for Medicare and the average. So this is where we were trying to concentrate on. Most of you know that Medicaid covers a variety of different populations, adults, children, as well as the elderly and disabled. But that's not true of the expenditures. The expenditures are not proportionate to the amount of coverage. The elderly and disabled cost much, much more than the adults and the children. Again, what we're trying to do at NGA is work with the governors to develop the better use of data and the application of that data to apply cost controls on the highest growing areas of Medicaid. I don't think Edward Bennett Williams ever did that with George Allen, but he got his winning team anyway. In any case, this horribly busy chart indicates just the top 20 of the conditions that that we are concentrating on. That is, taking a look at these 20s, there are savings to be made. If you focus the data on where you can make the savings and spend your attention on how to get at least as good a quality at lower price, you're going to have a better success. So we've developed this, and others have developed, not just NGA for sure. We've developed this and also taken a look at the kind of utilization metrics that are inherent in those top 20 to see if there can't be mechanisms, efforts. Sometimes they require spending more money in terms of personal interactions, so that the example that we'd like to use with governors is that inhalers for asthmatics, I think, cost about $1.29. A visit to the emergency room, if you haven't used the inhaler, cost about $2,000. there can be somewhere between those two figures where it makes efforts to make sure that the folks covered by Medicaid who have asthma not only have the inhalers, but know how to use them. And sometimes that takes more than just a physician or an emergency room or a doctor's visit, but it takes personal visits. It's that type of interaction, the $1.29 versus $2,000, that we're trying to work at in terms of saving some money. This also gets at per capita Medicaid costs in terms of, I mentioned asthma and a couple of other areas that we really want to work at in terms of controlling the costs. Now, having said that, I'm going to depart a bit from Dan's presentation here to go to the last slide, because it has been touched on the current political situation here in Washington, and not only where we face it now in the current area, but also what we're facing in the future. I said in my recent background the last several years, I've been living overseas, and so I have some experience in the international area. Before that, I was at CBO and the White House. In fact, 20 years ago, in 1991, that was the last time we actually had a sequester. The sequester came out of the Budget Enforcement Act. At that time, the sequester was implemented by 3 officials at OMB: the budget director, Dick Darman, who has passed away, the general counsel, a fellow named Bob Damas, who has since passed away, and me. And I've been in therapy the last 20 years. But the result of that is that my phone started ringing several months ago saying, oh my gosh, we're about to face this sequester. Exactly how does it work? And what is a PPA? And how much can you exempt defense from the sequester and only hit those guys in non-defense? Well, it was an interesting time, past coming back to haunt me. But with respect to going at now, the situation we face now, and one of the things I wanted to stress, particularly here in the Academy of Social Insurance, is that if you look into the future and what the nature of the fiscal problems are in the U.S. and the demographics were talked about by the previous speakers, we have the nature of our problems, particularly going out beyond the next couple of years, are clearly in the entitlement world. That's not to say we shouldn't raise taxes. Maybe we should. But the costs are clearly in the entitlement world. And they are much, much, much more in health than they are in Social Security. So I've just mentioned what we're doing at NGA, taking a look at this future and trying to work with the governors to say, look, this is not just a problem now, it is a problem that's going to be with you for a long time. But in that context, it was mentioned that the U.S. Total health costs are twice the next highest country. That isn't exactly right. They're twice the average of OECD. They're at 17.9%. The next highest country is France, where I was living for a number of years. And I want to use that as an example to point out some of the things that I think we need to do with respect to getting control of healthcare costs. My French is lousy. I could basically speak menu and metro. That is, I knew how to get to the restaurants and what to order. But I didn't have very good French other than that. But while I was there, I had to go see a doctor. And so I consulted my colleagues. And in Paris, if you want to go see a doctor, you can get on the web and schedule an appointment with the doctor. And not only will it identify the specialty of the doctor, where he's been trained, but also whether he speaks English or not. So I made an appointment, go to the office, the doctor's name is on the door, open the door, walk in, there's a small waiting room, a couple of chairs, 2 or 3 of which are full, and that's it. There's nobody else in there. There's no receptionist. There's no person sitting behind the desk. I didn't know what to do. I stood there for a couple of seconds. All of a sudden, another door opens up. Out comes a guy in a white smock. He goes, Monsieur Anderson. I go, oui, entree. I go in. The rest of the conversation was in English, thank goodness, and he did what he had to do, and after it was all done, I paid him, which I knew I was going to have to, the 25 euros as the co-payment. I was covered by the French insurance. That was the co-payment. The rest of the payment was entirely covered by the French insurance. I'm not commenting on that. But I said, look, I'm in the sort of the business here. I'm at OECD, and I'm involved in this. I said, don't you have an assistant? He said, of course I do. She comes in twice a week for 4 hours a week. I said, huh? He said, oh, yeah, I can't afford any more. And then his daughter, who is a French doctor, but his daughter who was training at California Institute of Technology, then we talked about the American system and a variety of other things like that. I came back from Paris a while ago. I go to get my eyes checked. The doctor looks at that, looks inside, says, Mr. Anderson, you have a freckle on your retina. I said, a what? He said, you have a freckle on your retina. I said, I didn't even know you could get such things. He said, oh, yes. He said, you know, it's like a freckle anyplace else. You need to check it out, make sure it doesn't get bad, but it's nothing abnormal, but you should go to the specialist. So I went to the retina doctor out in Bethesda, opened the door. Perhaps because of my French experience, but I did a little count. I counted 7 people before I ever saw the doctor. 7. And there was receptionists, there were billing people, there were schedulers, there were assistants, there were all different other kinds. And also, of course, there was a specialized machine that had to look in my retina. My freckle's just fine, by the way, but it had to look at it. No, that's fine. And I'm not complaining about the diagnosis or why I had to go in there. But I am suggesting that the whole structure of our system, not just administrative costs, not just malpractice charges, not just the use of capital equipment, that because it is owned by the physician and therefore has an incentive to overutilize it, but the whole structure, starting from fee for service down to superutilizers, and how we do that, we need to look at. And we haven't yet. We're happy at NGA to be working with the governors to start this process. And we feel, and the governors can reflect this, that frequently we have to do it at the state level because it's not being done at the federal level. But I would suggest to you that particularly you at Social Insurance, looking out at our fiscal unsustainability and what the social insurance costs are, health is the word, and we've got to do virtually everything if we're going to get it even down close to the level of France or the average of OECD. Thank you very much.
Thank you, Barry, for not just filling in for Dan, but also for your colorful presentation, which I think brought out 2 very important points. First, there was a nice flow of our audience, of our panelists, excuse me, from the global to the national to the state. And at the state level, I think Barry raised, in some ways, the larger context, which I would suggest is necessary as we go through our 2 days in this conference discussing the myriad issues surrounding Social Security and Medicare, that in fact there are other issues that juxtapose and impact how we think about the future of Social Security and Medicare, especially in a time of budget austerity. And thank you, Barry. For example, the issues of state spending, if, as some of our speakers have implied, whether Lisa, Richard, or Vanessa, that we need to invest in this new demographics, the future workforce, the future diverse ethnic racial populations, we may have some serious obstacles at the state level. Barry pointed out, for example, what we know full well in California. We now have our 2 largest cost drivers are Medicaid, or Medi-Cal as we call it, and prisons. Medicaid and prisons. K through 12 and higher education have dropped to, I think, 4th now in terms of our state expenditures. To make it even more dire, so to speak, we have built more prisons in California in the last 20 years than, matter of fact, we built more prisons, perhaps 12 prisons, and only 1 public university. So what does that say for a state that's already a majority minority? But I think the larger issue will be how Medicaid and other public programs come together, impact Social Security and Medicare, and we truly appreciate Barry, that you brought that to our attention. We have, by the way, amazingly, but not surprisingly, given the professionalism of our speakers up here, caught up on our time. And we have about 15 to 20 minutes. I want to do something a little different. I'd like you all to start thinking who wants to come up to ask questions of this extraordinary group. But as your reward, I'm going to ask each of our speakers here, I'm going to give you 2 minutes to add anything to your presentation based upon what you heard here. Anything that you think is relevant or insightful. We'll start off with Richard. 2 minutes. What would you like to add to what you said and or what you've heard?
Do I need to turn this on, or am I?
Yeah, speak there from there.
Okay.
I think the microphones are working.
Okay. Well, thank you for the opportunity, and I appreciate the lead time on preparing my response. I'll do.
You were so
I'll
good
do-
at the
I'll do
beginning, I
my-
just had to do this.
I'll do my best. Seeing the overarching theme of the panel was in some respects, diversity. Maybe I should start by saying something about that. I think that immigration gives a society an enormous comparative advantage, generally and in particularly in confronting the age wave, the aging of society. But that is provided that the society has the institutions and an economy and a culture that's able to effectively assimilate that. And I'm not an immigration expert, but all of the data I've looked at comparing experience in Europe versus the United States and other countries around the world suggests that despite so much of the angst about assimilation in the United States, that all of the indicators, first generation to second generation to third generation, move in a positive direction. So that gives us an enormous comparative advantage. Have I used up my time?
We'll go on to Vanessa. We can come
Yeah.
back. Thank you. I appreciate that. Vanessa.
Sure, that was actually really great. Thank you, Richard, for that, for your endorsement of sort of the immigrant experience and integration in the U.S. I'm an immigrant. I came to the U.S. when I was 15 years old. You probably heard my accent, but I have one of those really complicated immigrant stories in that my parents, like my mom actually came to the U.S. in the 70s, and she was a single mom. I was born in Brooklyn, New York. And then I went back to Bolivia, grew up in Bolivia, and then came back here to Virginia, which by then my family had moved to Virginia. And the first question I was asked at school was like, where were you born? And I said, Brooklyn, New York, and no one believed me. So they all put, she's from Cochabamba, Bolivia, and she doesn't know where she was born. But then I think I always tell that when I graduated high school, it made real clear to me how policy impacts you, because by that accident in my life that I was born in the U.S., when I graduated high school, I was one of 3 people in my class that could actually pursue college. And to me, it was a learning experience when I saw 97% of my classmates that couldn't go on, because they had different status and they had come, they didn't have the luck that I did. So policy does make a difference. So I wanted to just sort of highlight 3 things that I think I did not say. One is that I think that after the housing implosion that we had and sort of the economic dislocation that families saw, a couple of years ago, I think there's a conversation right now about inequality in the United States. And I think that before, that conversation only happened among people of color or low-income communities, but now it's a broader conversation. So I think there is an opportunity for us to take advantage of that. The second thing that I wanted to just also highlight, because it's something that the other speaker mentioned, is about how much we're investing in our future. And it is important to take care of our elderly. That's really important for all communities, because people of color, we're going to age too. We're going to get older too. So, but I think we really need to see, how much we're investing today. And according to a report by the Brookings Institute, today Washington spends $7 per senior citizen for each $1 it spends per child. And that's a huge gap, and we have to do what we can to close that gap and make sure that we are making the American dream available to the next generation of Americans, just like we have done for past generations. And those were hard battles when we fought for Social Security, whether we fought for the minimum wage or for any of those great things that make America what it is today. So it's not easy, but it's needed, and I think we all need to sort of exert our leadership within our circles to actually make that happen for all of us.
Thank you. Dan, your 2 minutes. And then please start lining up for the microphones if you wish to ask questions.
We at OMB used to have something we would call a reverse Robin Hood. Robin Hood is, of course, where you steal from the rich and give to the poor. A reverse Robin Hood is where you steal from the poor and give to the rich. We talked about that in some senses with respect to the intergenerational transfers that Vanessa just mentioned. The average wage of, I believe, of Social Security, though those who pay now Social Security is more than is less than the average income of the recipients of Social Security. We now have this reverse Robin Hood. If it's not exactly that, I'm not sure. But my second comment is it was very illuminating to me to live overseas, see where they get their news. It's entirely or almost entirely from 3 places: New York, Washington, and LA. They haven't any idea of what's between those areas, except a few of them know Colorado because of the skiing. But you live in Europe, that's where you get your news. But with respect to how we view ourselves, our glass is clearly 95% full. And as this conference has indicated, all we ever talk about is the 5%. And that's not bad. That's in part what makes us Americans. Europeans are not that way at all. Their glass may be 70% full, and they only talk about the 70%. Let's talk about the good life. Well, I say that because when looking at our situation and looking out into the future, it's good to remember these intergenerational transfers. I am extremely fortunate that I didn't sell my house when I moved to Paris, and I moved back. The downside of that is my kids all moved back, and now I live with my grandchildren. I had breakfast this morning with my 10-year-old granddaughter. I looked at her, I said, "Kylie, have you got a job yet?" She looked at me, "Grandpa, why do you always ask me that?" I said, "Because I need mine, and you got to go and earn it so I can get mine." She says, "Leave me alone, Grandpa." Anyways, intergenerational transfers wasn't something that was talked about much in the past. It needs to be talked about even more.
Thank you. Okay, with that, we'll begin with Mr. Rosenblatt.
Hello, Bob Rosenblatt, freelance writer. I'd like to ask the panelists and also Fernando to talk about the possible political stresses that will come out of 2 of the numbers that Vanessa mentioned. The average age for Latinos in the United States is 27. For non-Hispanic whites, it's 42. I understand sales taxes have been increased, but let's say as the future comes, the economy is under a lot of strain. If I am white in California or anywhere else, I want you to spend a lot of money on nursing homes, on rehab, on hospitals. If I am Latino, I want you to spend a lot of money for my kids K through 12, and I want you to make the California university system what it used to be. And if money is an issue, doesn't it inevitably become that we fight with our representatives to push the point of view we want? So how does that look, and how does that resolve itself if it does?
Thank you. Who among our panelists would like to share some thoughts on that? Please, Barry.
I mentioned that I'm not an R or a D. I also don't look at problems in red state, blue state. In fact, I think that's one of the most difficult trends that we have had in this country, where we want to simplify things and look, is it a red state or is it a blue state? And look at it in very simple things. I would note to you that there wasn't, in fact, an election last November. I don't know what happened here in Washington, but in the states, there were 11 gubernatorial elections. And the bottom line right now is that the 50 states are represented by 30 Republicans, 19 Democrats, and 1 independent. The trends that we are talking about with respect to demographic and things like that, yes. but I don't think it is right, or we should be looking at it in very simplistic red-blue terms. I think it is much more complicated than that.
Yeah. Richard, Vanessa, any quick response to the
You wanna
question?
go first? I think the specter you raise is one we need to be concerned about. Intergenerational transfer programs in the context of a society that's becoming increasingly diverse, where those who are paying don't always share the same experience as those who are receiving. I think what this speaks to is the overriding need to rebalance our spending priorities in our welfare state, and to pay more attention, as Vanessa was suggesting, to investing the future relative to rewarding the past. We, as an affluent, civilized society, we must ensure adequacy of income for the old, and I stressed that in my presentation. But we need to remember that for a welfare state, and indeed a society, to be sustainable over time, there has to be a very strong investment component. And if we look across the developed countries, the ratio of per capita benefit spending on the old to spending on the young is much more skewed towards the old in some countries than in others. In Sweden, the balance is much more age neutral. In the United States, it's very skewed towards the old. So we need to think about that and think about it hard.
The only thing I would like two things. The first one is that it is in everyone's best interest to invest in the next generation, even for those retirees. So who's going to buy their homes when they're ready to sort of go to the assisted care living? What are the workers that are going to take care of them? And those, who's going to be paying Social Security in the future? I mean, so yes, there are going to be those tensions, but I think we need to sort of shift the frame and say, what's best for both of these groups. And, and again, I gave the example in California that, the majority of voters in California just approved increasing an education tax. So, I mean, there are tensions, but there are solutions. And as long as we focus on what we need to do to ensure everybody's economic well-being.
Thank you. Let's move to the audience again, the gentleman to the left, and then we'll move over to Gene. Yes, sir.
Larry Polifka with the Claude Pepper Center. I think it also needs to be pointed out that minority elderly are disproportionately dependent on Social Security, Medicare, and Medicaid. I mean, this is truly intergenerational. First, for Richard, it seems to me that this tenacious sense of ownership of Social Security, and to a lesser extent, I suppose, Medicare, is very much a result of the contributory nature of those programs, or at least the sense that people have that they are, which means those programs are operating exactly as intended when they were created 70 or 50 years ago. So I don't think there's anything surprising about that tenacious sense of ownership. Two, for Barry, in talking about Medicaid, pressure on the states, you're talking primarily or disproportionately about long-term care, especially 10, 20 years out. And I'm wondering what NGA's actually got in mind for the future of long-term care, because I haven't seen much from the association, and I haven't seen any real attention paid to building up the private nonprofit aging network, which has really created the most cost-effective long-term care system in the country, which is the home and community-based system over the last 25 years. So it would be interesting to know what NGA's policy position is towards the private nonprofit aging network.
Okay. Let's have Richard, your response, and then Barry, yours, and then we'll continue to move. I'm going to cheat and go till about 11:50. I assume that's okay.
Well, yes, you're absolutely right. The tenacious sense of ownership must have something to do with the contributory nature of the programs, and this is indeed why the programs, one of the reasons the programs were initially structured on a contributory basis. Then again, most other developed countries, the great majority, also have contributory social insurance programs. I think one of the ironies here is that the sense of ownership is probably most tenacious among those who whose paybacks, the older generation, whose paybacks out of the system exceeded their contributions, and less tenacious among younger generations, where often the reverse will be true. And perhaps that opens up some room for discussion of reform in the future.
Barry, long-term care?
The executive committee of the National Governors Association met with President Obama in early December. It was to talk about not just Medicaid, but larger federal state issues and the flexibilities, the administrative and other kinds of flexibilities that could be worked on with that, including areas in terms of unfunded mandates and maintenance of effort areas. I mentioned the elections, and for the governors, we brought the governors in, the new governors in with some old governors who acted sort of as teachers, and one of the points we made was with respect to federal-state relationships, it ain't going to get no better than this. That is, if you look out into the future, whether you look out into grants or Medicaid or other kinds of things, the federal government is not going to be providing additional resources to what it's already being provided. So with that kind of thing, and there's been follow-ups to the meeting with the president, including one just yesterday, the governors are looking, and we try to help them look at a broader perspective of, including in Medicaid, at where they can take within the laws, work with Secretary Sebelius to see where there are administrative flexibilities to implement a better, more cost-efficient role. What have we done so far? Very little. Although I said that governors have been taking the lead more and more with our help on acute care, and we have, as I illustrated before, and as governors, Republican or Democrat, no matter where they're from, have a different attitude when tackling these problems, because they know, unlike the federal government, if they increase spending in one area, that means it's going to probably have to be a cut in someplace else. They can't just print the money or borrow it. They just don't have that options. Despite that, or because of that, in part, the reality is that in most cases, governors have been looking to the federal government for leadership in these mechanisms, in these savings areas, and it hasn't been coming.
Okay, thank you. Gene?
Gene Sterling of the Urban Institute. I want to ask a very broad question because I think it fits in with the topic today, but also the broad goals of the National Academy of Social Insurance. How do we raise up the larger issue of reforming the social welfare budget as opposed to addressing issues one at a time, Medicaid, Medicare, Social Security, where we get trapped in these debates over whether we like a progressive system or we don't, or whether we want larger government, smaller government, but we don't ask in terms of the redistribution within the system. So let me mention just several things that have come up very quickly by the speakers in the panel as well as by Lisa. So we're talking about a budget as well as an economy that increasingly is oriented towards consumption and away from investment. I think Lisa said this, and I think Barry, your numbers in terms of what's happening in the states in terms of favoring Medicaid over education clearly is in that direction. We clearly at the same time are favoring the old over the young. Again, the same data in terms of what's going on in the states. But also if we raise the intergenerational issue that just barely got touched on here, we know the rates of return for us, particularly in this room who are middle-aged or older, we're getting gigantic windfalls out of the system, and those are not going to go to the young people, so we're having this type of transfer. In terms of demographics, that's very interesting work which interacts this higher rates of return for early generations, which are predominantly white, with the lower rates of return for the other later generations that are predominantly minority or people of color, which means it turns out that Hispanics in some ways have made permanent transfers to the white population, at least in terms of issues like Social Security. It's not clear to me that's good. And then we also have this issue that's surrounding all of this that came up in Lisa's numbers about the transfers we actually, outside the public system, that are actually going to people of more high compensation. So that raises the progressivity issue. How do we pull this into a broader discussion? Those of us who favor a progressive system, how do we think about it more broadly in terms of how we fix the system as a whole, instead of trying to fix each piece one at a time and then trap ourselves, as I think we are trapped, or Barry shows in state numbers, and I could make a similar argument in federal numbers, that goes against investment, that goes against children, that goes against the young, and in some ways I think goes even against the people of color who are going to be the new majorities.
Who would like to provide a macro perspective in 90 seconds on that very big question?
Well, Gene, I mean, the first thing I would suggest is that you be made czar and of social welfare czar and be given, you know, full scope and full reign to reform the system. Let me just make one point. It's a very broad one. I mean, the issues you raised are so rich and so complex and so interrelated. I think we really need to take a zero budgeting approach. A zero budgeting approach and sort of an intergenerational equity approach. And let me just give a quick illustration of both. You know, on zero budgeting, it is absolutely true that healthcare is most of the cost growth in the entitlement budget. But at the end of the day, what matters is the total transfer burden. So we need to look at total transfers from the young to the old and whether they're sustainable over time. We have to stop looking at sort of the institutional silo of each program. I mean, as if Social Security were its own republic. So I guess that's my big point. We need to look at the total resource burden, not at individual programs, and we need to look not just at projections as a share of GDP, but at how transfers occur between generations and who the winners and the losers are. And then, of course, we also need to keep our eye on the overall progressivity of the system. If I knew how to do that, I would let you know, but right. I don't.
In the interest of time, let me allow just two more questions, the gentleman to my left and the person to my right, so that we can be democratic, small d.
Okay. It is very striking that this language is being used about intergenerational fairness. Because, of course, all the young would like to be old someday. And particularly in the context of NASI, this whole argument about intergenerational fairness is something that people should know better than to phrase as. In addition, I'm really struck by the idea that people want to talk about how much the federal government spends. Well, maybe the federal government is better at moving money for things like pensions and health care, and maybe it shouldn't be funding education. So as a policy analytic matter, if you focus on the federal government, you're not asking the policy analytic question of what is the best place to have various functions. Maybe the federal government is better for the elderly. And then the third thing, in terms of the policy analysis that's involved in looking at spending on the elderly versus spending on everybody else. You know, in any other country, they have national health insurance of some sort. So that the government spending on the elderly is smaller compared to the government spending on everybody else because they have national health insurance. Our excess spending on the elderly, supposedly, is because we have insufficient entitlements, not excess entitlements.
Thank you. Let me take that as editorial for the moment and then shift to this person here. Question?
Sure. I was just wondering, this is kind of going on a tangent, but considering the comment that in the future we can expect that young immigrants will be the ones primarily who are supporting older white Americans, I'm just curious if you have any thoughts about how the recently announced bipartisan move for comprehensive immigration reform will impact social insurance in any way. Thanks.
Well, you have brought the two big strands together. Thank you. This will be the last one, so any quick responses? Vanessa?
Well, I'll just sort of answer that. I think it's amazing and huge that we have these principles by a bipartisan group of senators. I think obviously the president gave his speech yesterday. So this is an amazing opportunity for the undocumented. And will it have an impact on social benefits? Yes, it will. I mean, I think for one, hopefully, if this actually happens, if a legalization program occurs, hopefully that will mean that they can actually access healthcare, which is an important issue for our community. But what's going to happen is that those that are not in support of immigration reform, they're going to say that this is going to create costs, and it is going to create costs. But there's also going to be income, because they're going to pay taxes, not just at the state level, but at the federal level. They're going to be more taxes. They're going to improve their economic outlook in terms of access and employment. So I think that we have to figure out ways to talk about how, if we're legalized and documented, how they actually fit into our public benefit system, and not make it a conversation about how much they're going to cost, but also about how much they're going to bring in.
Good. Richard or Barry, any last comments relative to this or anything else?
First of all, just a quick technical point. All of the data I've cited is for all levels of government. So the fact that the United States has a division of spending between federal and state and local is not relevant to my numbers. And a broader point, I would say that any discussion of social insurance that is bereft of consideration of intergenerational fairness is at the least short-sighted, and I would say even immoral. For intergenerational transfer programs, and that is how our social insurance system is basically constructed, to be justifiable, they must be sustainable over time. So intergenerational fairness is wrapped up in the issue of sustainability. And it's nobody's intention, and certainly not mine, to pit one age group against another. But I think it's about time that we started considering these issues seriously.
And I will take, thank you, Richard. I will take the prerogative of the podium just to quickly throw out two teasers relative to that last question, by just first simply saying immigration is an aging issue, and immigration is a social insurance issue. The second teaser is that, ironically, when we look at the politics of all these issues, President Obama in his first election, 08, re-election in 12, the only age group he lost continued to be the 65 and over. And when we looked at who did not support the Affordable Care Act, the largest group opposing it were persons 65 and over. Yet, as you mentioned, it's that over 65 that has been most supportive of maintaining Social Security and Medicare. So we have this kind of strange dilemma that we're facing here. And as I've argued, and Mr. Bob Rosenblatt, I think he wanted me to kind of get to this comment. One of my goals has been how to make a case to the over 65 white retiree conservative population who will support us on these two big programs, but not necessarily on everything else related to diversity and demographics. How do we get their buy-in to maintain to create an intergenerational, interethnic, interracial type coalitions? And I found it actually quite effective in speaking to senior citizen groups in Orange County and Newport Beach by simply not only raising these inevitable changes, but posing the self-interest question, who will ensure that your Social Security and Medicare will continue to be sustainable in terms of tax dollars? And the only group left that can ensure that are Hispanics and Asians and other immigrant groups. So maybe that's one of our charges. How do we create a new narrative that can appeal to all political ideologies and age groups, so that in fact we lessen or mitigate any tensions or conflicts between age, race, and ethnicity? But with that, we'll just leave it with you. Let me thank our panelists. I think you would all agree this has been a stimulating, insightful, provocative group. And Barry, Vanessa, Richard, thank you for giving us an excellent start to this conference. We appreciate your time and expertise. And thank you all.